Hi there. In preparation for lab on Friday, I would like you to work through a couple patient cases on your own so that we might discuss the clinical reasoning process of diagnosing, screening, referral for different patient cases with low back pain and lumbar screening. So here's our first case that I'd like you to prepare for Friday. So this is a patient, this is adapted based off a patient that I saw in clinic earlier this year. So patient is 47-year-old female presenting to your clinic with a referral of lumbosacral radiculitis. Not going to read the whole patient case history, but here is what is going on. So I'll let you read through that. And after you've done so, what I'd like you to prepare for Friday is two parts. First part, I'd like you to practice your preparation and communication with the patient. So we're going to have a chance to do that in lab, but in order to effectively do that, I need you to think to yourself and justify, will you continue your examination with this patient and perform objective testing? Why or not? What is your clinical decision? Will you choose to treat this patient or will you refer? And if you do choose to refer, to whom will you refer? And then second, we'd like you to practice communicating with patients and providers. So part one is kind of your preparation. Part two, you're gonna try to make some decisions based on how you're gonna communicate. So how will you communicate your examination findings, your clinical impression to your patient? So be prepared to do that in lab. And then assuming, regardless of what your decision is to treat or refer, we're gonna have you practice communicating the referral. Even if you choose to treat, we'd like you to prepare. So assuming you decide to refer, how will you communicate your referral request? Would it be email, phone call, fax? And what would the content of that referral look like? And then this is kind of the decision tool or decision model that we utilize within the screening PowerPoint. So assessing your level of concern, your treat or refer decision, and identifying the appropriate referral. So just to guide you again with your decision making, and this is what I would like you to do. Spelled out in words, preparing for Friday. The next two cases, not as much preparation on communication, but these are gonna follow the template that I introduced in the screening PowerPoint. So what I'd like you to do for the next cases, patient case 3 and then patient case 4, is to do these three things: assess your level of concern, treat or refer, and identify appropriate referral if needed. So practicing our screening processes with these different patient cases. So this is going to be patient case 3, 78-year-old woman. You can read through the case description on that. And then case 4. And in lab, we're going to have a chance to talk through the reasoning process, and then debrief a little bit and discuss why you might have made the decisions that you did and how we can learn through that process and really link back to some of the findings, red flags, signs and symptoms, things to highlight within these patient cases that will hopefully make you better at and more confident at screening for these different serious spinal pathologies in the lumbar region.